Most women worry about their biological clock. But what very few women realize is that there are actually two clocks ticking. One is your calendar age, the number of birthdays you've celebrated. The other, far more important one, is your ovarian age. And here's the inconvenient truth: your ovaries don't care how old you are on paper. I've seen women in their late 20s with very poor ovarian reserve and women in their late 30s with excellent egg numbers. Why does this happen? Because you're born with all the eggs you will ever have. Over time, both the number and quality of these eggs decline. How fast this happens depends on genetics, environmental exposure, and lifestyle, not on how fit you look or how regular your periods are. This is why some perfectly healthy, slim, physically active women are shocked when they struggle to conceive. Their body looks young, but their ovaries are aging faster. That's why understanding ovarian age is so important. Ignoring it is like planning a long journey without checking fuel levels. The good news is that checking your ovarian age is easy. A simple blood test called AMH gives you a snapshot of your ovarian reserve. I recommend checking it once a year. Think of it as tracking your ovarian clock on your birthday. If your AMH is low, don't panic. It doesn't mean zero chances. It simply means you need to plan intelligently and act sooner rather than later. Sometimes we also check the antral follicle count with an ultrasound for more clarity. Knowledge gives you options, and options give you control. If you want honest, unbiased answers about your fertility, you can get a free instant second opinion by chatting with my IVF chatbot. The link is in the description. Because informed patients make better decisions, and that changes outcomes. VF failure hurts deeply. After all the injections, scans, hope, and courage, the one question every patient asks me is, "Why did it fail, doctor, when everything looked perfect?" Here's the uncomfortable truth: even a textbook IVF cycle can fail. Good embryos, a normal uterus, perfect hormone levels, a flawless embryo transfer, and still no implantation. Why? Because implantation is still a biological black box. Once the embryo is transferred, nature takes over, and nature doesn't give explanations on demand. This is where things get dangerous. After a failed cycle, patients want answers and clinics want to offer solutions. That's when unnecessary tests enter the picture. Many so called failure tests have a terrible signal to noise ratio. They find problems that aren't real, miss the ones that matter, and leave you confused, anxious, and poorer. Take ERA. It assumes timing is the main issue. Most of the time, it isn't. Or PGT, useful in selected cases but not a guarantee. A normal embryo can still fail, and an abnormal report doesn't always mean that embryo could never have become a healthy baby. Immune testing? That's often science sounding nonsense with very little real world benefit. Once the embryo is inside the uterus, there is very little anyone can control. Medicines can't force implantation. Bed rest doesn't help. Diets, yoga, and superstition don't change biology. Often, less intervention is better than more. The most common reason IVF fails is also the hardest to accept: genetic abnormalities in the embryo, especially as eggs age. This isn't your fault. It isn't bad treatment. It's biology doing quality control. And no, IVF failure does not mean you'll never succeed. Many couples succeed after multiple failed cycles without changing anything. Sometimes the honest answer is simple: you need more attempts until luck shows up. If you've had a failed IVF cycle and feel lost, confused, or pressured into unnecessary tests, get clarity first. Use our free IVF chatbot, powered by AI and based on my 40 years of clinical experience. Upload your reports, ask the right questions, and make informed decisions without being misled. Visit drmalpani.com/chat-w-chatbot. Knowledge won't guarantee success, but it will protect you from mistakes.